Welcome, welcome, welcome to For Example. My name is Daryl Yates. I am the founder and creator of this podcast. You're going to be captivated on what she has to say and her knowledge and just her ability to convey a message that we all need to learn from. We are going to focus in tonight on women's health. I encourage you, once you listen to this segment, to please ask questions. And I will get those questions to her and have her answer them as soon as possible. I am honored to introduce to you on, for example, Dr. Kendrick.
Thank you. Thank you. I appreciate you often giving me this opportunity to be able to speak on this platform. I appreciate that. I am Dr. Latoya Sanders Kendrick. I work in the state of Indiana in women's health, and I have about 20 years now, 20 years of experience in women's health. Started out as not saying started at the bottom, but started out working on the floor as a nurse, went back to school, got a master's degree, and wanted to just have a terminal degree and go further in my education. So went back to school, went through all the clinical trainings with the whole family. And here I sit now as a doctor at the age I am now. I won't share my age, but yeah.
It doesn't matter. So as I always say, black don't crack. So I'm not at all caring about the age at this point in time.
Right.
I would just say, in just speaking with you prior to today, I'm just captivated in your journey. I know you explained a little bit on some of the things you did to get to the point to where you are today. Yeah. One of the things that I've always asked with the doctors I've encountered who look like me is, what is some of the things that you have to deal with to almost prove yourself of being a doctor? I mean, please share with us, because oftentimes when I ask these questions, I think people get confused that there's no struggle once you've done all the training you need to do. There's no struggle for you to come in and do what you have been trained to do.
Yeah.
But you don't see what goes on behind the scenes because you are not, either you don't want to see it, or you avoid it. So with that being said, please tell folks some of the things you have to deal with pretty much on a daily basis.
Yeah. Just blatant disrespect. Blatant disrespect is something that I deal with on a daily basis. And it used to be mostly from like older staff, not used to seeing someone of color in this position, believe it or not. But I can't even say it's older staff now. It's pretty much everybody, especially, with the culture how the culture has shifted in the past 5 years, I could say. I've had, instances where I deliver babies for a living. So when just walking in rooms, I've been caring for this patient, her entire pregnancy, her and her family. And then I walk in the room for a delivery and you have families saying, well, where's the doctor? Who's delivering the baby? Well, that's me. That would be me, the one standing here in the scrubs with all this equipment on to deliver the baby. I mean, like, oh, I thought you were the nurse, or, oh, you just look so young. I get, all kind of things. In the medical field, everyone's trying to level the playing field. So oftentimes, you go on a first name basis. And that's fine and cool, when you're addressing your colleagues. But I feel like with staff in front of patients, that should still be, the respect should still be given. I don't mind you calling me my first name, but, it should still be Dr. Latoya or Dr. Kendrick, whichever, I'm fine with either or. But I think because when staff, when they learn that I do have a nursing background, that's like how I started many years ago. I've had nursing staff say, well, you're a nurse naturally, so you understand what we're saying. We feel so comfortable around you, or you understand our struggle. I do, but I'm not a nurse now. That's not where I am. That's not my position anymore. Not discrediting anything, because I'm sure that's made me function better in my role now, starting where I did. So, and it's not just people of other races. I mean, I've gotten it from people who look just like me and you.
And
You know?
that's where I just want you to expound on, how do you feel when you walk into a room, ID blatantly being shown, you in your white coat, your stethoscope, Lord knows, trying to pronounce that. Hope I got it right. But have everything, have all the equipment on, but the patients or your potential patient is looking like, okay, when is the doctor coming? How does that make you feel?
Well, it used to enrage me, to be totally transparent. I used to really get in my feelings about it, like, how, like, come on. And then I got to a point where I was just like, oh, I went to, swung the total end of the pendulum and was just like, oh, well, it doesn't bother me. And I think right now I'm in the middle. And I worked hard to get to where I am. I mean, blood, sweat, and tears. Student loans, let's not even go there.
Yeah, please don't.
So, yeah.
Please don't.
But I feel like at this stage in
don't.
my life, I don't care what you think, how I should or should not look, or what my education should be. I don't have to prove anything to anybody. So my education, my training, and the care that I provide stands for itself. So if they don't recognize, I make sure that they do when we meet. I introduce myself. Hi, I'm Dr. Kendrick. I'm here to take care of you. Or what brings you in today to see me? You obviously made an appointment with me. So I'm here to, and I'm a transparent person. I try to, meet people where they are. And I feel like after people get, patients or families get to know me, they appreciate that.
So just say, what would be a typical day when you start off in the morning?
Yeah.
How would your morning start? And how would your day end?
Well, yeah, that varies day to day. Being in being in OBGYN field. So most days start seeing patients in the office about 7:30, 8 o'clock in the morning, and you have like 15-minute slots. So it just depends on how many slots got filled that day. And then hopefully finish by 5, but most times, you run a little bit over. I try to give, patients a leeway with getting to the office on time, especially if I know they have like transportation issues. I try to give them a little leeway. But on other days, I take call in the hospital. So I am on call from 7 a.m. one day to 7 a.m. the next day, or sometimes that extends for 48 hours. So there's days that I am awake, 24, 36 hours working. And as that's not easy, but it's the field I chose, and I get through it. And those are typical days. It could deliver anywhere from 1 baby a day, or maybe not a baby, or I think the most that I've had was 10 babies in one day. Wow. And that's not all vaginal deliveries. That could be cesarean sections as well. So be scrubbing on those. So I feel like that is a pretty long day, when you're up like that and you still have family and you're still trying to make sure, kids are taken care of at home. But this is the field I chose. So go ahead. Sorry.
I'm sorry. No, and again, I could just let you just keep on talking, because again, I'm just totally captivated in the sense of what your work schedule is and the things that you have to do to ensure that your patients are getting the best treatment possible. While you were speaking, I was just sitting here wondering, how many people that look like you are in that same field, just on average in the state that you're in?
You know, that's a good question. I don't know if I have the exact data to provide. Where I previously worked, there were many of us. Like I worked in a practice where there were a practice of 10 and 7 of us were people of color. And I mean, you know, probably 6 of us are African Americans and there was like one Indian person.
Okay.
And then one Asian. So, but then here, when I moved here, there are, I think there are 5. And I work for a pretty large organization. So, you know, I wanted to backtrack just a little. So when I said I went back to school too, I trained as a midwife before I got my doctorate degree because I knew that I wanted to deliver babies, but I felt like I could provide a better service. Not better because midwife, I'm not saying anything about that. I just felt like I didn't want anything that I've been through to be wasted. So I felt like I needed to embed myself more in the culture of things in order to make a difference from the inside out. So I wanted to, that's why I went back to school. So I have various training, but yeah, it's the number of Black female at that docs that we have. There may be 5 of us in our organization, but I'm sure there are plenty more around here. But
so with that being said, I know that there is a major issue with the healthcare field, and what I'm leading to is in the inner city. I have dealt with a lot of families in the work field that I'm in, the career that I'm in, where the healthcare system is almost non-existent in the urban communities, in communities that look like us, who are not middle class, who are below the middle class status.
Yeah.
Why is it that we don't have more facilities that will cater to us in those communities? If everything that we talk about is supposed to be community-based and everybody's equal, so on and so forth, but the reality of it is a lot of the families that I have to deal with have to travel a very, very long way to get the appropriate services, and not just at a free clinic. And don't get me wrong, I'm not belittling any clinic because something is better than nothing at all. But if you compare those services in the urban communities in comparison to the more affluent communities, it's night and day. So why aren't they in more urban communities?
Well, that's a pretty heavy question. Generally, I mean, if we really want to narrow it down, it's really a matter of bean counting. Insurances, they pretty much run it, insurance companies, big corporations. In underserved communities, most patients, most families have what is the insurance they have? They have the state provided or government provided insurance. And when we look at our DRGs or look at like what we're, the cost per patient that we look at, those state or government funded insurance companies only cover like 60% of what the bill is, versus your commercial insurances, and who's affording the commercial insurances, the middle and upper class, they pay 90% or 80%. So I feel like in underserved communities, that is the main issue. It's hard to get, it's all about money. Basically, it's all about money. It's sad to say it's all about money. I think back to when I was young, our docs, they're down the street, or we even have one at church, he, bring his bag, and that's what we did.
And it is funny that you say that, because my next point is my doctor, I just read online, Dr. Jenkins, just passed away within the last few weeks or within the maybe last month, early last month or the month before then. But Dr. Jenkins was my doctor. He was also all of my relatives' doctor. He was he worked with my grandmother. So he knew the entire family. And my point is that when we went to go see Dr. Jenkins, he would sit back and just talk about my uncles, my family. He actually cared and saw and made it personable. So whenever I went to the doctor's office, I felt more as a person rather than just a number. And he ensured, and not only did he talk to me and explain to me what was going on, but he did follow-up calls.
Yeah.
How many doctors do you know nowadays that you would actually get a call at your home and he would know my mom by first name, and then not only would he ask about me, but then he'd ask about my grandmother, then ask about my uncles, and that he might be on the phone 5 or 10 minutes, just making sure that I'm A-okay. And Lord knows how many other times that he actually went out of his way just to treat folks that he cared for without even charging them.
Yes, right.
We don't have that nowadays.
No.
And I get into these conversations where you cannot afford to be sick, which goes into my next point of I do personal training. I always practice what I preach as far as the importance of healthy lifestyle. What is one of the things that you would suggest to the women as an overall whole on what they can do to improve when they go to the point of becoming pregnant, and some of the things they can do to ensure that they're going to have a healthy child?
Yeah. Can I go back and address quickly what you said about your docs?
Yes, please.
So, back in the day, there were more docs in private practice, right? So at that time, private practice was private practice. You charge what you did to insurance or not, but you got paid at a higher rate. And how many docs now, how many private practice physicians are there right now? I cannot even think of any, even from I can hardly think of any private practice right now.
Which is unfortunate.
Everyone is better. Yeah, it's more cost efficient to be within an organization as far as medical malpractice, as far as insurance reimbursements. That is a major thing because, it used to be you could, I remember just with my kids, taking them to the pediatrician if, before I even, when I had state, and I had government insurance myself, it would be nothing for her to give us a sample of, cough syrup or breathing machine medication, or give us an extra tube for, that was nothing. But now, with pharmaceutical sales, with the way insurance is such cost containment now to where we don't have that. We don't even have samples in the office anymore. So just wanted to address that's kind of it's unfortunate. It's a really unfortunate thing. But then we also need to have more people that look like us that are willing to pull together and offer these services in the communities, free clinics, or even just, pick a Saturday every other month and we're going to offer these services. So, and just a little disclaimer before we go any further, I am not offering any medical advice. I feel like you should, see your personal provider, whoever that may be, with any issues you have. But these are my thoughts, how I treat my patients. But as far as women's health, that is my passion. And it goes back to just how I was treated myself, as a young woman before I became pregnant, even had children. So, I see women throughout the lifespan. So from adolescence through menopause. So that could be anywhere from just, I have parents that bring their teens just so that I can have a chat with them about their bodies in general. That's a tough conversation for parents to have with their, with their young adolescent daughter. Hygiene. That's number one. Let's start there with hygiene. And I'm pretty blunt with my conversations that I have.
And I want you to expound upon, when you say hygiene, are you just talking about the cleaning process, the menstrual cycles? Please go into depth. What do you mean by hygiene?
When I talk about hygiene, I feel like when I talk to, people, I tell them the best investment you can make is in yourself. So hygiene to me is from top to bottom, and mentally too. I start with, what is your routine?
Mhm.
You would not believe how some people are just not as educated as others on how to care for their bodies, from your hair to washing your entire body. We talk about vaginas. I tell people, tell them, let's get a mirror. Let's look down there. So many people have not looked at themselves or become familiar with your own body, how to track your cycles and how to care for yourself during that. Um, there's odors or irritation or discharge. We talk about that. And that's just
I want to ask one quick question, and please continue on. But I always wondered, I've heard that by having the birth control, the implants or whatever, and I'm asking strictly for your opinion, no medical advice, just your humble opinion. And you don't have to answer if you don't want to or you feel uncomfortable. Is it natural to have birth control implants in your body as a means to control your cycle? Because I've heard some women that have their cycle in over a year or 6 months or 2 years. I don't know how true that is, but help me understand, please.
Yeah, that's a loaded one. If you're asking if it's natural, literally, no, not natural, not to have a cycle. But that is one of the side effects of, or as we say in medicine, one of the benefits of some of these birth control options of not having a menstrual cycle. So if we're going to talk about that, if we were talking about, say, the implant, which is the Nexplanon, you mentioned implant. There's an implant that goes in your arm called Nexplanon, or there's an implant that goes in your uterus that's called an IUD. So that, or there's a Depo-Provera shot, which they all work the same way. They all have the same hormones essentially. And that, what that does is it slows or stops ovulation. You will still shed the lining of, when you have your menstrual cycle, that's what you're doing. That egg has not been fertilized. So you're shedding that egg in the lining of your uterus. So you're not going to shed the egg because you're not ovulating, but you are going to still shed, some layers of your uterus. So you won't have a bloody discharge, but it'll be more of a clearish or mucousy discharge. Is that natural not to have a cycle? No. And I try to advise, like what I say, I like to meet people where they are. So if it's an adolescent or a teen or a young lady going to college and she wants a birth control option, we discuss that. But how responsible are you going to be taking a pill? You want something that's more natural. Okay, you have to take a pill at the same time every day in order for it to be as efficacious as it needs to be. But are she going to remember to do that in college? Most likely not. Or you have a new mom with a baby and she already has a toddler. Is that mom going to remember to take that pill at the same time every day? Probably not. So the best option for her at this point in her life is to get this device that she does not have to think about. It's there and you don't have to think about it, and we'll deal with what we're going to do with later. I don't think that they're advantageous to African Americans. I feel like in my experience, we have more severe symptoms with those birth control options. As far as weight gain, hair loss, acne, mood, depression, anxiety, it affects all those things in our culture a little bit more than I've seen in other cultures. But like what I say, again, if that's the most effective way and that's where the help that she needs, then I would say go with that.
And then going back to the hygiene, and I know I cut you off. I just had to ask that question. It was just for my own personal, not usage, but my own personal, just wanted to get some clarification on that. But you were saying hygiene. Please go back to when you was explaining that. What does that entail?
So again, I asked, who I'm talking to, like, what is their routine? Some people actually have been taught to douche, which which is the good old vinegar bottle or baking soda, whatever your choice was. And that's how my grandmother and, frankly, my mother, that's what they did. That's what they taught. But, I mean, we're adults on this thing, but the vagina is a self-cleaning oven.
Yes.
It's going to clean itself. It has its own acid-base balance, and we want to keep that balance. If you are putting things in there that are not the same pH as your vagina, what's going to happen to that area of your body? It's going to become the pH of whatever you're putting in there. And that's not natural. So you're creating more issues with the dish. You're just rinsing bacteria back in there, and your body's not able to create its own microbiome pH balance. So let's not do that. There's nothing really, you don't need to put soap inside. Let's just wash on the outside and keep it moving, but definitely become familiar with yourself, especially around your menstrual cycles. Know what your body is doing. You have hormonal shifts, and a lot of us don't know why that is. Some of us experience extreme premenstrual syndrome, and everybody in the house is running from us the week before our cycles because we're just so angry or enraged or sad or anxious. But let's recognize that there's a hormonal shift, and a lot of that has to do with our diets.
Okay.
A lot of it has to do with our diets, but it's what we're taught in our culture. So I feel like everyone should be their own citizen scientist and search out what you want to know, but then bring it to your healthcare provider and talk about it. What you don't understand. I do not mind answering questions in the thing. And I feel like it's an honor that they thought of me to bring it to me to say, hey, doc, this is what I read, this is what I want to do, but I don't quite understand why I would or why I wouldn't. So I appreciate those questions. Again, research it out yourself, be your own citizen scientist.
And I think nowadays and I say we, I'm including the men, we would go to our doctors and don't ask the questions because we're afraid of what the answer might be.
Yeah.
I know for me, everybody that I speak to, all my frat brothers, all my male friends, people who I haven't seen in a while, whatever the case may be, I said, hey, for one, we're not getting any younger. Two, have you done your annual checkup? Because the majority of the people I went to college with, everybody's right at 50 or over 50. And I said, if you have not had a checkup at this point in time, or prostate or any other, anything, just your annual checkup, if you have not been routinely doing that, I highly recommend that you go and do that. Because right now we are not even preventing, or we're not even addressing the things that we can prevent. And which goes back to my whole personal journey of when I post different things, it's not just say, hey, look at me. It's a matter of, hey, keep active.
Right.
Hey, stay focused on what your health is. Hey, you don't have to have that fast food burger every single day. It's okay every now and then, but it's okay also to cook your food.
Yes.
And today we have way too much sodium, way too many carbs, way too many things that we used to eat when we were younger, and we can't do that anymore.
No, we can't.
I know I can't. I know I can't eat like I used to, because if I did, I'd be on that 600-pound life. And don't get me wrong.
Say that right there.
That I mean, again, I have seen myself 3 years ago in comparison to now.
Yeah.
It's all about a matter of moderation. Me exercising, I don't do it 7 days a week. I do it 4 to 5 times a week. And I don't try to do it 4 or 5 hours a day. I do it less than an hour. Approximately 35 to 45 minutes, give or take. I say all that to say, I look at a lot of our culture, people in our culture, we are dying. I have seen or heard about more deaths from heart attacks and so many other things over these past few years. It's kind of scary to even answer the phone sometimes, especially if it's from somebody you haven't spoke to in a while.
Yes.
So one of the other things that
can we talk about that though?
Yes, please.
Talk about why we're not getting preventative care. I mean, look at the rates of heart disease, or like what you said, heart disease, high cholesterol, diabetes, look at the combination of that.
Yes.
Look at the combination. Diabetes, and you have diabetes and high blood pressure. Like, what's your morbidity rate at that time? I mean, those are two major comorbidities. And I mean, it's culture. It's culture, of course. It's how we've been eating for years. I think of older adults, my parents, they've been eating that same way for all of their lives. And it's hard to change that. But why are we not seeking preventative care? Just because we don't know that it exists doesn't mean that it doesn't exist. It's not going to go away. So why not treat, at least get some treatment, early treatment. As far as men's health, yes, you should be doing exactly what you need to do at 40, need to do at 50, 60, 70, 80, 90, to expand your lifespan.
And what's really upsetting is you would have a doctor tell you, young man, young lady, you're 100 pounds overweight.
Right.
Young man, young lady, you are your cholesterol level, like I was told in 2001 or 2, my cholesterol level was 285.
Wow.
I was right at 250 pounds, which is the heaviest I've ever in my life of being. I had adult acne, my back was hurting, I couldn't sleep. Everything was wrong. He gave me some Lipitor, and I tell this story, everybody gave me some Lipitor to lower my cholesterol. I'm not a medicine guy, never have been, and I don't plan on being that. So I took Lipitor for about a week, and I said, you know what? I'm going to get my lazy butt up, get back to exercising, and modify my eating habits.
Right.
It wasn't even 2 years later before, or maybe 3 years, however long, Lipitor is no longer on the shelf because it causes cancer.
Yes.
Now, again, I'm saying this from my own personal view. You do whatever your doctor has prescribed for you to do. I'm not a doctor, nor do I try to play one, but I know me. I know the person in the mirror. People out there, whoever's listening, you do what is best described for you. If your doctor say you need this,
yeah, exactly.
then you go for it, because I don't know your medical history. But I'll also say too, that if I can get out and consistently walk, or do a little bit of jogging, or do a little bit of jumping rope, or anything of that nature, just to get myself to where I don't feel as lethargic, and take a little bit more care of my health care and my healthy lifestyle and how I eat, that will make a world of difference. And my last point before I let you get back on there, I always tell people, they say, oh, well, the way you eat is really expensive. I said, well, but a co-payment and all that medicine you have to buy is a hell of a lot more expensive than this healthy eating. And it takes a lot more time when you got to wait in the waiting room. With that being said, one of the other
your 5 medications is going to cost
big
more
time
than me buying this fresh fish and veggies and cooking it at home. Right?
And I also say too, just go and try some fresh fish,
right?
Instead of frozen. Go and try some fresh shrimp, or try something that you cooked at home, and just taste the difference then when you buy from the store that's already been frozen, and has a shelf life. Just when you do something go to the farmer's market. You can go buy a head of lettuce, some cabbage, some greens for a third of the price of what you have to pay at Snooks, Dearborn, so on and so forth. It costs a lot more of your time, but you would taste the difference in the foods that you eat when you get them fresh. And I always tell, in my last point, for now, I always tell folks, instead of going buying orange juice, just go buy some oranges. Just go buy some oranges, just eat oranges. Just go and do that instead of buying orange juice. Because the thing is, you want it as fresh as possible. Now, again, I had to build to that. The person you see today took some years. But I encourage you to start today. I encourage you, if you're not doing any more than just walking up the street, or instead of taking the elevator, take the steps, do those things, because it's going to benefit you. Now, any comment before I go to this?
I feel like everything in moderation. You know what I mean? Everything in moderation. It's okay if you like whatever fast food that is. Okay, that's cool. Let's do that. But everything in moderation. There needs to, you need to have less intake than the calories you're expending, which is
Makes a
hard to
world of
do for
difference.
any life. That's not easy for anyone. This person sitting here, I agree with the person sitting here today is not the same person I was 2 years ago versus the same person 5 years ago. We're
Yes.
every evolving beings, but I feel like when you know better, you do better.
Yes, I
So,
agree.
but a flip side to that is some of us don't have farmers markets. Some of us, only have a Dollar Tree or
Yes.
something, that we shop at. But how do we do that? Well, we meet you where you are. Let's talk about, well, let's go to the frozen, vegetable section versus getting your canned green beans.
Great point.
Let's look at things that are low sodium, less sugar. You'd be amazed that if you just cut, instead of drinking your calories, you ate your calories,
Yes.
versus, getting that soda or that candy bar, which are empty calories.
Yes.
But
And
again,
potato chips,
yeah,
all those
yeah,
chips,
let's talk about
totally empty calories.
yeah, trillions. So, I mean, again, I try to meet you where you are, but like what I say, better, you do better. And some of us just don't know. This is how we've eaten our whole lives. And this is, what'd you have for breakfast? A bag of Fritos,
Yeah.
bag of Cheetos. That's the teens tell me that all the time. That's what I had for breakfast, and that's what I always have. Or
In St. Louis City, the kids, what they get is hot chili cheese fries
yeah.
or those flaming hot Cheetos.
Mhm.
That's their breakfast and a
Yeah.
soda.
And
And
soda
and it's, I mean, and they'll go all day long and eat that
all day on that.
and
And
won't.
come home and put that microwave pizza
Yes.
in, and that's dinner. And then they have their late night. Yeah, that's how it is. And just uh, imagine just, when I have a young lady who's pregnant and a teenager, trying to get her to understand how she needs to nourish her body, because the pregnancy is going to take what the pregnancy need, and you get what's left. And if you don't have any reserve, you're not going to feel well. So, let's try to, I really enjoy talking to adolescents. Not that they enjoy all the things that I say.
Mhm.
And it's not like it's a joy, like, oh, I want to talk to adolescents, but I enjoy being able to tell them things, in a way that they understand, and things they just don't know.
Yeah.
So that's my
Know better,
soapbox.
you do better.
Yeah.
I wholeheartedly agree with that.
Hmm.
I One of the questions that I know this was going on a few years back, and it
Hmm.
seemed like every young lady I spoke to that were in their mid 30s, late 30s, 40s, and 50s,
Hmm.
everybody I talked to at one point in time was talking about, well, I got a partial hysterectomy. I got
Hmm.
a hysterectomy. I got this. Help me understand, why was that such a go-to method for that period of time?
Well, during that period of time, that probably was a little more. Yeah, there was a period of time where there were so many hysterectomies going on with Black women. It was like, what was really happening? So, I go back to, not that I'm a conspiracy theorist, but I go back to, like, there's a book, there's a journal called Medical Apartheid. And it basically talks about medical racism
Mhm.
and how, just to try to control the race. I mean, we can go back to slave days on this, to our ancestors. That is a lot of times, how they control our population. Not saying that's what happened 5 years ago, but again, at that time, 3 to 5 years ago, when there were so many people getting hysterectomies, I think there was a lot of jumping the gun. As African American women, we tend to have a higher incidence of fibroids, like we have fibroid
Mhm.
uteruses, we have fibrocystic breast. Um, Again, that's genetics. There's nothing we can do about genetics, but how we take care of that is up to us. I truly believe that we are the answers to our own issues, and outside races really, they don't have the answers. We tend to want to run to them, but there are people qualified to help us move forward in this. But if you know that you have a family history of fibroids, or that you yourself have fibroids or have fibrocystic breast, then how do you take care of that? You keep an eye on them, first of all. And the rule used to be, if they don't bother you, you don't bother them.
Mm-hmm.
But with fibroids, you tend to have heavier menstrual periods. It's more difficult to conceive when you have fibroids. And your cycles, you have a lot more cramping. So you have a lot more lower abdominal and pelvic pain. But those fibroids grow if you're, first of all, a smoker. Nicotine helps those fibroids to grow. Sugar helps those fibroids to grow. Stress, the hormonal imbalances, that helps them to grow. And caffeine. So if we made small changes in our lifestyles, maybe, they wouldn't be so fibrocystic, but then again, sometimes they are. I think that, if you have small fibroids and they're not bothering you, then we can leave them, and just every year we'll do an ultrasound and we'll check on them just to see if they're growing or not. But if you have, 8 and 10 centimeter fibroids inside your uterus, that's extra tissue growing. And, just culturally, we have a higher incidence of cancer.
Mm-hmm.
So I truly believe that at that point, you probably should think about a hysterectomy or a myomectomy, where they either remove the fibroids or they take the entire uterus. And what is a partial hysterectomy? Partial hysterectomy is either they take your uterus and they leave your fallopian tubes and your ovaries, so you still have hormones, so you're not thrown into menopause. And a total or complete hysterectomy is when they take the ovaries, the fallopian tubes, and your uterus, and that in turn puts you into menopause because you're no longer producing the estrogen that you normally would when you have those ovaries.
Wow. I just got taken to school. Wow. I mean,
Didn't know. Yeah.
I don't know how. I mean, it's so.
I mean, it is. It's very common. But again, it goes to genetics. We as African Americans, we do have a history of fibroids. But it's our hormones, it's our lifestyle, and it's genetics. A lot of genetics.
It's so many more questions I could ask.
Mm-hmm.
But what I'm gonna ask of you, here's what I'm going to do.
Mm-hmm.
Because I can sit here and just keep on asking and just be totally engulfed in your knowledge of your field, your career. What I want to do is have you come back.
Mm-hmm.
But what I want to do is put this information out there and then have whoever's watching ask questions.
Oh, yeah.
And then what I want to do is come back and just have some of the questions that were asked. I'm gonna ask you, and then you answer them. Mm-hmm. Because again, this is all about education.
Yeah.
This is all about having the information to help you live a healthier life. And I say this, like I have these discussions all the time. I explain to folks it's great to prepare for your retirement. Put your 401k, save all this money, do all these different things, have everything paid off. And majority of the time people retire, just say at 60, 62 years old. What good is it to have $500,000 in the bank, but you are not mentally and physically able to enjoy it?
True statement.
Because if you are in a facility where you have to get rehab because you are not able to walk, or you are not mentally stable, or your obesity has gotten the best of you, or you're diabetic or high cholesterol, you're on kidney dialysis, so on and so forth, all that money you have in there, you can't enjoy it. You can't travel, you can't move around, you can't walk even up your steps in your home because you are not physically able to enjoy all those years you've been working. And I stress to people, stop just existing. Live your life, because you are not promised tomorrow.
Amen to that.
Doc, I'm not gonna say, hey, goodbye, good night. No, I'm not saying that. What I'm saying is we are going to pause this conversation so I can get the people who watch this podcast to give them an opportunity to sit back and ask you questions. Please, I will work around your schedule to ensure that it is conducive for your time frame, because I know you're busy, so on and so forth. But I want the ladies to be able to feel comfortable enough and free enough to ask these questions so that you can answer them, because oftentimes these questions don't get answered by people that look like them.
Right. I'm a fan. I'm all for culturally competent care. That seems to be the term that so many organizations are using. But I believe in culturally relevant care. Let's talk about the real issues. I know how you're eating at home. I know about the fried pork chops, and I live the life. Don't let the degrees fool you. I definitely get it.
Mic drop.
But let's have some real conversations, and so I'll be happy to come back and answer questions. And I feel like if some questions may not want to, they may want to be anonymous. So if you could figure out a way that could happen,
we're gonna work it out.
Questions that way in a forum. And I just feel like everyone should just be their authentic self, be your best authentic version of yourself. Put your best foot forward. So not that this is to belittle how you're eating or what you're doing or decisions you've made, but again, it goes back to when you know more, when you know better, you do better.
Now it's time. I've had too many people leave this earth suddenly, unexpectedly. Some due to their own negligence of themselves. Some it was because it was their time. It's one of those things where you are not promised tomorrow. You really are not. And I think oftentimes people take life for granted. Live your best life. Do not allow yourself to become complacent with what you're comfortable. It's okay to be uncomfortable. And what I mean by being uncomfortable, it's okay to ask those questions to get yourself back in a healthier lifestyle. It's okay to go and get a checkup. It's okay to stop going out and not adhering to a lot of the peer pressure of people like, oh, yeah, I remember you used to drink all the time. If you don't want to do that no more, then stop doing it. And if those same people around you are still trying to pressure you, then it's time to change those people. It's okay. Because again, we are not promised for tomorrow. With all that being said, this is just a pause, an absolute pause. We will work something out, doesn't matter. We're going to work something out. So ladies, I want you to ask the questions if you don't feel comfortable by putting it out in the public, but I just want you to be mindful too. Some of the questions you ask may be a question that somebody else been wanting to ask, but they didn't know how to ask it, and it gets answered. But if you're not fully comfortable, we will make arrangements to get that information out there. But ladies, I need for you to listen to what has been said thus far. We probably barely scratched the surface, but I want you to listen to this podcast, ask some of the questions you've been wanting to ask, and let's get ourselves back healthy. Let's get ourselves back on the right track.
And where does healing start? Where does healing start?
Yes.
Healing starts with the truth.
Exactly.
Let's get the truth. Healing starts with the truth. Any true attempt to reconcile or you become healthier, it starts with the truth. So let's be truthful with ourselves. And there are no judgment zones here. I've had a gamut of issues being presented before me, and I don't cast judgment, but I do believe in telling the truth. And so, however that works for this platform, I'm happy to help.
And I thank you so very much. I'm honored for the simple fact you took out of your busy schedule to even sit back and join me on this, for example, podcast. I again want to reiterate what you stated earlier, that these are your opinions. These are not medical advice. Right. These are my opinions. Lord knows I'm not a medical doctor in any way, such fashion or form. But I want you to take advantage of the opportunity of this knowledgeable young lady to help you get yourself back in order, get yourself back healthy. And again, I want to stress as well, it's something beautiful when you have somebody that look like you that will answer those questions. That doesn't mean that if you don't look like this young lady, that you cannot ask questions. But at the same time, we oftentimes do not have doctors that look like us that work on us.
Sure.
And it's okay. It's definitely okay. So please do not hesitate to reach out, ask these questions, watch this, and we are going to continue this. So with that being said, I thank you. I will see you again. We will talk about this again. And I cannot stress the importance of your knowledge, your information. And I just want to thank you for the service you provided, not only just to your community, but around the world. Because I know you affected so many people and you probably just don't know it at this very time, especially people who have moved from different various states and probably out of the country. So again, I thank you. And
I thank you for thinking of me. I thank you for thinking of me and allowing me to speak. Thank you.
Until next time.
Until next time.
All right. You take care.
You too.